Our final guest. Now, going to the GP, as we know, isn't anyone's idea of a good time. Appointments often run late. You need to wait in often unpleasant waiting rooms, and it can be hard to find a park as well. Our next guest has a solution for everyone. Dr. Deepak Gore is providing patients with the choice of when and where they see their GP with Pop-Up GP, and he's here in the studio to tell us all about it. Great to have you. How are you?
Good, how are you?
Yeah, really, really well. Tell us about this. It is a nightmare situation, and I think it really turns people off from probably booking in. Where did you come up with this idea, first of all?
Look, I thought about this idea after coming back to Australia, having lived in New York.
Yep.
I'd worked in the pharmaceutical industry, and I was looking for a new challenge. And I was thinking about the type of model of different healthcare we could provide to Australian patients. It is a challenge getting to the doctor.
Yeah.
It is a challenge getting an appointment of your choice. It is a challenge if you've got to change your appointment. And so I came with this concept of Pop-Up GP, and we're really trying to provide a personalised general practice that really caters to your lifestyle. So you can choose to see us by video or face-to-face at your home, your office, your aged care facility, or at our clinic. You can book appointments online, you can cancel appointments online, and you can see us at a pretty broad range of hours, 7 till 7, Monday, Tuesday, Thursday, and Friday.
Awesome. So before we talk more about what you're up to there, why is it so hard? Why has it been so hard in the past for people to book appointments and just everything surrounding it, really?
Look, I think when you establish your own practice, doctors become busy pretty quickly.
Right.
And so typically, you don't plan to be sick. And if you wake up Monday morning and you're unwell and you call your doctor's already got patients who are already planned to see them.
Yeah, sure.
They might be seeing them for their chronic disease, as they usually do. They might be seeing them for something that came up, say, the weekend beforehand.
Yep.
They might be something planned, like a child's vaccine. So the doctor's already busy. The doctor's already got appointments. And to find a time for you when they're already full, it's actually very difficult.
Yeah, sure. That's actually a good point. In terms of valuing the patient's time, I think that sometimes for the patient, they think, do you actually care about my time in any way? Obviously, it can be difficult for doctors, but how are you trying to value their time?
So we're trying to provide, 20-minute, 40-minute, and 60-minute appointments, so quite long appointments.
Right.
We're trying to space out the appointments and also build in time, between appointments so that we don't run late.
Okay.
Patients are often very disturbed when you are running late, but they realise that actually you're running late because you're with another patient, and then they're not too fussed about it. But I think it's important to explain that to a patient, and also try and provide structures in place so that if you're running late, you let them know.
Sure.
And use spaced appointments so that you can try and see patients on time as much as possible.
What's some of the feedback you've had from people who have been involved, or what are they sort of saying to you?
Look, people, the idea has really resonated with people.
Yep.
The concept that you can actually plan, your day, and it's not an impediment to actually see a doctor. We're offering office-based appointments, so I will come to a patient's office. That's very, very different. Obviously, it needs to be an appropriate office. You couldn't do it in an open space plan. You need to have somewhere where you can actually examine a patient, like a sick bay or somewhere like that. And so it's an idea that's really resonated with the feedback I've got so far.
Yeah, right. Where can we find out a little bit more? And is this for everyone out there, do you think, or is it a special sort of group of people who should be listening?
So we're initially opening in the inner southeastern suburbs of Melbourne, so Toorak, Hawkesbury, South Yarra, Prahran East, Windsor, St Kilda Road, Albert Park, Middle Park and East Melbourne.
Okay.
They can find out more information at our website, www.popupgp.com.
Awesome. Well, I think a lot of people would be very happy to hear it. Even for me, it reminds me, I've got to book in a GP's appointment, so maybe I'll do it with you. Yeah. But the fact that it's easier, it's just going to enable us to, everything in the world is becoming easier, right?
That's right.
Even these, more laborious kind of difficult waiting room sort of situations, everything needs to be easy, right?
Yes, exactly.
Yeah.
You've got to think about the patient and how do you provide the service the patient requires.
Totally. Mate, enjoy the rest of your day. We'll have to talk to you again soon this year and see how everything's going. But thanks so much for your time.
Thanks, Adrian.
Great stuff.
See you.
I do need to book in an appointment. I'm not joking at all. Okay, moving